Down syndrome is a very common chromosomal abnormality that we come across nowadays. Though it is not the most common abnormality that we come across in pregnancy, it is the abnormality that is compatible with life. That means the child has the chance of the pregnancy will progress up to term and the child will be born with the syndrome. And though the life expectancy is shorter than others, the child can live up to 40-45 years with this with all the intellectual disability and congenital abnormalities. So it is very important to diagnose Down syndrome beforehand so that we can prepare the parents for the good counseling and also to give them the various options available, whether to go ahead with the pregnancy or whether they are thinking about termination. So all this we can do only if we come to know beforehand that the child is affected with Down syndrome. So how do we come to know that whether Down syndrome is there in the pregnancy? For this we have a screening test that is scheduled between 11 and 14 weeks. In this test we do ultrasound scan and also we draw blood from the mother and we look for two blood components, and we combine all the 4 parameters and then we get a risk suggesting whether the child has a chance, whether the baby has a chance of getting Down syndrome or not. Suppose it's showing a low risk, we need not do any other test in that direction. But suppose if the result is high risk, then we have to do a test to confirm whether the child is affected or not. And the confirmatory tests include amniocentesis, chorionic villus sampling, etc. And another option that is available nowadays is non-invasive prenatal testing, where the mother's blood is drawn and looked for the fetal cells and examined under the microscope so that we will know whether the fetus is affected or not. But this NIPT again is a screening test and it is not a diagnostic test. Amniocentesis and chorionic villus sampling are the 2 diagnostic tests available, and the NIPT is not a diagnostic test. Suppose you are missing the 11 to 14 week screening test, you have an option after 15 weeks, between 15 and 18 weeks, that is called triple test. But here the detection rate is less compared to the 11 and 14 week screening test. The detection rate is only 65%, whereas for the first one it is almost up to 95%. So it is very important for all pregnant women to undergo this test between 11 and 14 weeks to rule out Down syndrome for the fetus.